And good morning, I'm Mabel Jong, and we're at the final day of our conference here in Washington, D.C. Thanks for watching. And I'm very pleased to have in the studio right now Dr. Bernadette Melnyk, who is Chief Wellness Officer at The Ohio State University. Good morning, Dr. Melnyk.
Good morning.
It's great to see you again.
Great to be here.
Well, I absolutely wanted to check in with you because we've seen that there has been federally mandated recommendations that depression screening should be very much a part of the primary care setting. How would that happen, and why aren't more settings incorporating it?
That's an outstanding question. So the United States Preventive Services Task Force, which I had the pleasure of serving on for 4 years, has evidence-based recommendations that all teenagers between 12 to 18 years of age, all adults, including pregnant women, be screened for depression in primary care practices when systems are in place for accurate diagnosis and treatment. As a pediatric and psychiatric nurse practitioner, I have long conducted national workshops to teach providers, pediatricians, nurse practitioners, family practice physicians, how to better screen for, identify, and treat mental health problems in primary care settings. The one comment I consistently get from those providers is, we don't screen because if we screen and find problems, we don't have access to mental health providers that could treat our patients. Now, access is a big problem right now. There's a tremendous shortage of psychiatrists, psychiatric mental health providers throughout the country. But again, if we can just teach primary care providers these skills, they could handle so much more cases of depression and anxiety, which are our most common mental health problems.
Okay, and leading into my next question then, you yourself have conducted a study that evidence-based practices or treatment are rarely utilized in the primary care setting. So is it because the training is not there and there is a lack or shortage of professionals to really handle these kinds of issues?
There are a lot of barriers to evidence-based practice. Providers say time, culture, that's the way we do something here. But through 28 years of my research career, I have, through my research, developed and tested cognitive behavior therapy-based intervention programs that I have formatted into brief 25 to 30-minute sessions. And you don't need to be a psychiatric specialist to deliver these sessions. They are coping skills. In CBT, we teach people that how they think directly relates to how they feel and how they behave. These are coping skills, problem-solving skills, emotional regulation skills that we can teach any child, adolescent, or adult how to use in order to decrease stress, anxiety, and depression.
Okay, very, very important. These skills that you're referring to, the basics that you've already gone over, are there specific ways that physicians can speak and address these issues with the teens or whoever it may be in the office?
Absolutely. Again, my evidence-based program manualizes these skills. So literally, it is a toolkit, a guide to help kids, teens, young adults get these skills. I'll give you one example. We teach in this COPE program the ABCs. A is for an activator event. It's for a stressor that causes you to have a negative belief that follows. For instance, in a teenager who's in an art class, somebody may call a teen's project, "That's really weird. I can't believe you just drew that." And so the teen would have a negative belief that follows, such as, "I don't do anything right. Nothing I do ever works." And as a result of that, they get depressed or they get anxious, and then they don't want to try anymore. What we teach in the program is how to stop the negative belief, turn it around to a positive one so that you feel better and behave in healthier ways. But you got to put it into practice, and that's another element of the program. So after each of the sessions, we have skills building activities for the teens, for the kids or the young adults to put into daily practice in their lives.
Well, Dr. Melnyk, have some of these stressors, if you will, these issues, have they always been around, and we haven't recognized that they were stressors, or are there additional stress-related situations that our young people face today?
I think multiple stressors have been around for years and years. Family dysfunction, peer pressure, divorce, remarriage, those things have all been around for years, but now we have compounders. Technology can be great in so many ways, but it has also led to other stressors. For instance, cyberbullying amongst teenagers has become a major problem that contributes to depression and anxiety now that wasn't around decades ago because of the social media epidemic that we have now.
Absolutely. What are some of the takeaways you absolutely want people to have with them when they leave this meeting, Dr. Melnyk?
I want people to say, we do have evidence-based solutions. We do have evidence-based programs that we have to scale. We have to start using. It takes, on average, 17 to 20 years to take findings from research and translate them to real-world clinical settings. We need to condense that time gap. Once programs, evidence-based programs like my CBT-based programs get published, we now then need to have primary care providers and schools say, "I'm going to implement this because we know it works," not implement other things that have no evidence behind them.
All right, Dr. Melnyk, thank you so much for your time today. We really appreciate it. And may I ask you, we love seeing you at this meeting. Why do you put it on your calendar each year?
Because we need to have a stronger voice in venues like this. We have people across different disciplines at this particular Congress, people who can take what the knowledge that they hear from these meetings and go back to introduce change and innovation in their systems. So if I can have an impact on positive outcomes, especially for children, teens, young adults, I want to be visible and to do that.
Dr. Melnyk, thank you again.
You're welcome. Delighted to be here. Thank you for the opportunity.
And I'm Mabel Jong. Stay tuned, more interviews to come.